everyone. Today, let's talk about what you should do in an outpatient physical therapy clinic. So, by now, you probably have mastered how to introduce yourself. Essentially, for me, I go, "Hi, my name's Aman. I'm a student physical therapist. Today, I'll be working with you for the next 15 minutes. Is that okay with you?" Throughout the process of working with you, I'm going to be needing to facilitate by putting my hands on your body and facilitate some movements that way. Is that going to be okay with you? You have your little spiel that you probably learned through your school, and if you haven't yet, this is something that you're going to work on. And so make sure that you use your little spiel to introduce yourself to your particular patient, with, of course, always remembering your title, student physical therapist. The next thing that you want to look at in an outpatient setting is you want to look at the patient's posture. Are they sitting down and filling out their paperwork? Are they hunched over, or, are they sitting with proper posture? When they're walking in front of you, you tell the patient, you greet the patient. Now you're saying, "Let's go into the eval room. Go ahead, I'll walk right behind you," and you're automatically doing a functional activity assessment on them. That is, you're seeing how they're walking, you're seeing what are the places where they're deviating and where they need work. Seeing them already walk in front of you, looking at their posture, you're looking at their alignment, you're looking at the places that they need to improve on. And this is all without the patient even knowing that you're actually already observing them. Go ahead and get started on that when you initially greet the patient and have them walking into the room. When you're sitting there in the room with the patient, you want to ask about their chief complaint. And majority of the time, it's a really good idea to document the chief complaint in the patient's own words. That way it's very clear that those goals or the complaint that the patient has is actually, it's not being misinterpreted from what they said to what you've written down. So it's a good idea to put it in quotes as to what their complaints are, and then you can actually do the same for their goals as well. Asking the patient what their goals are towards the end of your eval, and then again putting those in quotes, and that way again it's not going to be lost in translation as to what their goals and their complaints are. To ask for the chief complaint, you can actually say, "So what brings you into physical therapy today?" Or you can say, "Out of everything that we've discussed, what is the thing that is mainly the biggest problem for you right now?" And that's a great way of honing in on a specific problem that the patient has, even though they have a laundry list of issues that they want to work through. The next thing you're probably going to do is you're going to palpate the area or touch the area. So if they're coming in for their elbow and you want to see, is it hurting? Is it tender to touch, or is there a swelling in the elbow? What is exactly going on? So what's important for that is for you to be able to then expose the area. You want to expose the elbow. You're not going to look through it, with over a chunky sweater. You're actually going to look at their actual skin and figure out what is the color of the skin. Is there, swelling? Then you would probably take a girth measurement. So always expose the area, figure out what's going on underneath whatever clothing that they're wearing. The next step is usually looking at their range of motion, so their physiological range of motion. Now, depending on the problem that they're presenting with, that could mean active range of motion, in which the patient is going to move their own limb through space, or it can be passive range of motion, in which you're the one, as the PT, moving their body in space. And so you want to ask them, what are they coming in for? For example, if they're coming in for back pain, you're probably going to have them do lumbar flexion, which is folding forward to touch your toes, for example. And then if you are, if they're coming in for some shoulder pain, then you might want to do shoulder flexion or extension, whatever those ranges of motion that you want the patient to go through. That could be active, which is the patient doing themselves, or passive, which is you doing it. But you also want to make sure that you know what the normal ranges are. So for example, for shoulder flexion, the normal range is 180 degrees. And then you want to be able to document, okay, well, did the patient meet the 180 degrees? Is it within normal limits? Or did the patient not meet it? They were minus 10 degrees, or whatever the case might be. You want to check out their range of motion when they are coming in for their initial eval. The next step is special tests. So depending on the nature of the problem that the patient is coming in for, you have a lot of these tools that when you're going in for that first clinical. So special tests can be figuring out, for example, if we're going to use the ankle, figuring out which ligament might be torn. If the patient came in and said, oh, I'm just having so much instability in my ankle, then you might want to use some of the special tests that you've learned to figure out, well, what's the reason? What is causing it? Is it a muscle? Is it a ligament? What is the problem? And what structure is specifically causing it? So in order to implement those specific structures, you have certain tools that you will learn that can be then used in your clinic. So depending on the time that you have at this point and during the eval, you can either go ahead with the special tests or pretty much pick it up the next time you see the patient. So let's say you weren't able to get the special test done. It's okay. You've told that the patient should come in, twice a week for therapy. The next time that they come in, you can do the special test then and see how they're doing. Special tests are really important to rule in or rule out specific structures. So certain tests for the hip joint, the knee joint, the elbow, whatever it might be, you're trying to figure out what specific structure is responsible for the pain that it's causing the patient. Now, you can use tests depending on their specificity and sensitivity levels to rule things in, to rule things out. So it's also important to know the statistics behind the tests that you're going to be running to ensure that you're not ruling something out when it should be ruled in. So knowing those specificity and sensitivity numbers can be a good idea. Again, this is not something that this is not something you're going to need to memorize essentially, because you're going to take your notes with you into your clinic, hopefully, and then you're able to look at your notes if you really need to really quickly. Again, not recommended that you do this in front of a patient, but once you've seen the patient, you're going to say, I'm going to step out for a really quick second. I'm going to bring these tools, and then while you're bringing the next TheraBand around, you're going to go ahead and look at those numbers really quick and make sure that you're understanding what you're doing with the patient. This is the next step that potentially was the very first step that was done in the clinic. At least in my clinic, that's how it was usually done. And I think majority of the clinics probably do it this way, which is when the patient comes in, the receptionist at the front desk is then going to ask them to fill out a specific questionnaire. And this is the standardized outcome measure. So majority of the time, let's say someone's coming in with low back pain, the questionnaire that you might give them is the modified Oswestry scale. So that's specifically for low back pain. It's going to ask the patient several questions about, what triggers the pain, what brings the pain on, how is it, how does the pain subside, what activities are you able to do comfortably, or what activities are you not able to do comfortably with this pain. And so the standardized outcome measure is a tool that you're going to use from the initial appointment. Okay, this is how the patient is doing the first day that they have come to see you, and then you also have them fill that out depending on how long the visits have been in the middle, which would be considered like a progress note. And so you would want them to fill out the outcome measure once again to see how they've improved. Hopefully they've improved. And then towards the end of your visits, the same thing. You're going to have them fill out this questionnaire to see how have they improved. And that's going to be really, really important, because you want to make sure that you're able to track improvements in your patient's progress. You're trying to figure out what the function and the pain of the patient is initially, and then how has it improved as they've continued physical therapy. We kind of touched on this a little bit before, but the very last thing that you should do while you're still documenting in your eval is asking them about their goals. The goals are really, really important for us as physical therapists, because we're not just treating their pain, we're usually trying to get them physically well enough to participate in the things that they want to do. For example, when I was working in outpatient physical therapy, I was working in a town that had a beach nearby, and so everyone, majority of the time, was like, oh, I want to go on the walks on the beach again, but my ankle hurts, or my leg hurts and I can't do that. Or people would be saying that they want to surf again, but their knees, giving them a lot of trouble, or I've just had something happen to my hip and I'm not sure. So the idea being that us as physical therapists, not only are we just treating, the pain or the impairment that they're coming in with, we also want to help the person become physically well enough to then be able to return to the things that they enjoy in their everyday life, which I think is so, so important. Because, imagine if there was something that, you aren't able to do anymore that you really, really enjoy, it's going to make you kind of, not really enjoy life as much. And so as physical therapists, we get to help people get back into their life and get back into doing what they like to do best. And so in order to figure out what people want to do, you have to ask them their goals. And again, you really want to make sure, if you're able to quote them on their goals. Hopefully they're able to meet these goals by discharge day. If you liked this video and you like physical therapy related content, please like and subscribe. If you have any suggestions for other videos, leave a comment down below. Otherwise, thank you so much for watching and have a good day.